Tell me your name and a little bit about yourself.
Well, I'm Jonathan Bunnell. I'm born and raised from Glasgow, Kentucky. I graduated from Barron County High School back in 2015. Then I came over here to Weston to pursue a Bachelor of Science in Biology. Got my minor in chemistry, and then I was able to go over to the Kentucky College of Optometry over in Pikeville and get my degree for optometry, and able to come back over here and start practicing. And I found a love for eyes and a care for taking care of people, serving people, and doing all that, able to take part in mission trips and just finding who I am and who I am as someone that serves people.
So your decision to specialize in optometry, did that kind of come with your decision to be a doctor? Tell me about how that all came to
be. So I actually took a high school course with Intro to Medicine, and one of our projects was to determine what you wanted to do. And at that point and this point, blood's not my favorite thing in the world. And so I looked around at some specialties that didn't really deal a whole lot with blood. And so I found eyes, and I said, eyes, that's pretty neat. I could kind of get into that. I see my eye doctor every year. Let me look into this.
Well, now that you're established in your practice, what is your favorite thing about it?
My favorite thing is hearing good stories from patients, is seeing them and coming back in for follow-up exams, and they say, "Doc, everything's going so much better." Hearing those stories, oh, it's the best part of clinic every day, every day.
What was it that attracted you to this area? Obviously, you're from very near here, Glasgow, and talk about that and what attracted you to specifically Graves Gilbert Clinic.
Bowling Green's an excellent community right now. You look at any of the cities in Kentucky, and Bowling Green is growing. Bowling Green is thriving. Bowling Green is a place where people can raise a family. And that's what I wanted to be. I wanted to be a dad. I wanted to be someone that's here to raise a family. More importantly, I see the people that are coming in here knowing that they need care. I had the opportunity to work with Dr. Moore previously, and in conversations during optometry school, I talked with him, and he mentioned there was still a need here in this area. And knowing the area, going to school here, I thought, oh, what a better way. You couldn't write a more perfect story to see the needs, see how the city's growing, and to come back. Graves Gilbert's an area that cares about people. I couldn't describe a better work environment. The people there are what makes a clinic. They're the people that make you want to be seen. I always tell people, I have a joy coming into work every day because of the patients or because of the people I work with. Graves Gilbert's a clinic that cares about people at the end of the day.
Tell me about the main strengths that you bring to this role.
Right, so one of the things that I primarily focus on is dry eye. I was fortunate enough to spend this semester with Dr. Paul Karpecki at Kentucky Eye Institute while I was in school. He's a dry eye guru. He knows all about it, and getting to see firsthand what that's all about and the research that's going on. It's an area that many people are affected by. For years, there wasn't much research on it. And so now we're actually able to find ways to help people rather than just, oh, your eyes are dry, use some drops. We're actually able to take care of people and make their eyes feel better. Also focus on a lot of just disease states with the eye. Many people have lots of things going on with the front of the eye, the back of the eye, things that affect their sight. They come in and things aren't looking too good. But knowing that we have tools again to help them and tricks, we want to focus on helping them as well. Giving people even their first pair of glasses. It's something that's so important. Helping people learn how to wear contacts. Having that confidence. That's such a confidence builder, is wearing contacts, wearing glasses for the first time and seeing the world around them. Helps them with their jobs, their relationships, their overall life. When you can see better, you feel better a lot of times. And so that's really what I want to bring to the table for us.